Hi, I'm Dawn Morse, the founder of Core Elements Training, which delivers Level 3, Level 4 and Level 5 sports massage and sports therapy training courses.
I'm Katie Campbell, I'm a lecturer for Core Elements Training. In this series of videos we're going to be looking at the examination assessment for the peripheral joints, focusing on range of movement, ligament testing and muscle testing. In this video we're going to be looking at the examination assessment of the knee joint, focusing on range of movement, ligament testing and muscle testing. If I get on the couch. Okay. We're going to go through the active movement, the passive movement and the resisted movement. We're looking at flexion first. So just ask your client to flex their knee, slide their heel up the couch towards their bum and then relax. Don't forget to compare good to bad. For the demonstration purposes, we're just going to focus on the one leg. Passively, you ask the client again to perform the movement actively. So just bend your knee, slide your heel up your bum, and then supporting up the top of the knee here and the ankle, you just gently move the joint to the end of range, feeling the end of range, and relax. Remember not to ever bounce the joint. For resisted, we do it again. So ask your client to bend their knee. They relax. The therapist then moves the joint a little bit further and they resist you. So they try and straighten the leg. So if you straighten the leg against me, hold for about 3 seconds and relax. For extension, actively, you ask the client to push their knee into the couch. And you should ideally get a little bit of gapping underneath the heel. Passively, you ask them to do it again, holding it above the knee, just by the Achilles. You ask the client to relax your leg, and again you just take that a little bit further, feeling for a nice soft end of range. For resisted, exactly the same again. The client performs the movement, pushes the knee into the couch. Then you ask the client to relax, take it further, and they just try and push against you. So they're just trying to put their heel back down on the couch or bending their knee slightly. So you hold them in that position and relax. That's the range of movement. We're going to look at the ligaments. So you've got the lateral collateral ligament, known as the LCL, and the medial collateral ligament, known as the MCL, anterior cruciate ligament, known as the ACL, and the posterior cruciate ligament, known as the PCL. So we're going to do the MCL first. So we want to put that on stretch. So just use our hand just above the knee. Pop your hand underneath the thigh, and you're going to try and bring the ankle towards you, making sure the client can stay relaxed. And for the LCL, just the opposite. So the block is on the inside. You can always change position as well if it's more comfortable. And then you'll just be holding the ankle, pushing it away from you, stressing the lateral collateral ligament. And relax. For the ACL and PCL, we need the knee flexed, about 90 degrees, and you can just rest your leg on their foot, give it more support. Just hold right above the calf, as close to the joint line as possible. You can have your fingers on the tibial, your thumbs on the tibial tuberosity, and you just push away. There should be a little bit of give, but it shouldn't move too much. And then for the ACL, we're just pulling towards you. And again, just feeling the laxity of the ligaments. The muscles we test around the knee can include the rectus femoris, the quadriceps, the adductors, gastrocnemius, and the hamstrings. For the quadriceps, we need in sitting, so we can test if you face the camera. Okay. We do these one at a time. They're a large muscle group. Get the leg into about 90, and the client just matches your resistance, pushing away from you. So just push away, just hold for about 3, and relax. If the client looks like they're using a lot of support from the couch, using the extra force, you can ask them just to pop their hands in their lap. And again, just push away. Just watching for any trick movements. For Rectus Femoris, we do it with the client leg down. So just ask the client to
Oh, if you go.
pop this way. So here we need the leg off, and all we're doing is they're going to be trying to flex at the hip and extend at the knee. The rectus femoris is biarticular, so it crosses both the joints. So if you push up with your knee for me, and again kick out, so all you're doing is holding in this position while they're trying to straighten the leg. So you're on the tibia and on the quadriceps. For hamstrings, we turn the client over onto their front. So you roll over, please. So ask the client just to bend their knee and push it up to about 30 degrees, and you can see their hamstrings working. They also cross the hip, so as in Rec Fem, we can ask them to extend at the hip. So if you extend at the hip, so bring your thigh up, hold that, and then they'll try and flex at the knee as well. And relax. For gastrocnemius, you can ask the client to just shuffle down the couch. You want them in slight dorsiflexion, putting the gastrocnemius stretch slightly. Using your thigh, just ask the client to either step on tiptoes or push against your leg. And again, they just hold that position and relax. For the adductors, if you roll over onto your back, please. We've got Brevis, Longus and Magnus. So we can try and isolate them the best we can. So ask your client to have their heels together, knees bent. So for Brevis, we just use about a fist width just between the knees. And you ask the client just to squeeze and relax. For Longus, you can use about two fists, or you can just hold and relax. Then for Magnus, about the length of a forearm, and then you ask the client just to squeeze the knees together and relax.